Now look closely here. Again, a very simple but a beautiful illustration that I have created. First, look at the teeth. Teeth are fitting into each other perfectly in a patient who has both the discs in its proper position. Now concentrate on the left side of your screen, all right? Look here. The disc is displaced forward and the condyle has been pushed back. So what happens to this straight line plane that I have created? Look closely, the plane gets tilted. Why? Because now the balance is gone, right? I mean, once the balance goes away, the plane tilts. It's not just the discal plane or the condylar plane that tilts. Even the occlusal plane tilts, which is why you may hear a patient saying, डॉक्टर साहब कल तक बाइट एकदम सही था लेकिन अब ऐसे लग रहा है इस तरफ टच कर रहा है, इस तरफ टच नहीं कर रहा, क्यों नहीं टच कर रहा? इस तरफ से डिस्क डिस्प्लेस हो गई है. And guess what? If there is a unilateral disc displacement, which is more common than bilateral, the problem does not just end here. Why? Because if someone's bite changes, right? If the entire occlusal plane changes towards one side, guess what? The human system is designed to compensate for change. So if the bite gets changed in one direction, automatically an individual tilts the head in the opposite direction, only to bring back the occlusal plane so that it's parallel to the floor or parallel to earth. Guess what? If the head tilts, be it 1 degree tilt, it doesn't have to be a 10 degree tilt. Even if it's a 1 degree tilt towards one side, guess what? The entire upper body has to overcompensate in an attempt to align the spine straight. Now what happens? Because the upper body has to realign itself, at the hip girdle, there has to be more correction. When there is correction at the hip girdle level, there is correction at the knee level. When there's correction at the knee level, there is also correction at the ankle level. And most commonly, people who have pronation of the leg, which means it creates like a flat foot effect. पूरा का पूरा जो सोल होता है वो अंदर की तरफ बेंड हो जाता है. Guess what? Literature says this is probably a joint related problem. Which joint? The temporomandibular joint. Think about it. This joint is the highest joint in the stomatognathic system. It's away from earth, all right? It's most away from gravity. यहाँ पे अगर कुछ problem होगा, it has a cascading effect all the way down to the sole. Patient who has a knee issue, that is unilateral. Patient has a hip issue, that is unilateral. Patient has a shoulder problem, that is unilateral. All of it eventually comes down to possibly how the muscles are and how the joint, that is the temporomandibular joint, इसको कहते हैं ना, एक डोमिनो गिरा ना तो सब डोमिनोज लाइन से गिरते हैं. That is how important, friend.